Welcome to reFramed, a podcast created to educate, encourage, and inspire parents and professionals. The research is clear. Parenting a child that has a history of loss, abuse, neglect, or trauma requires parenting skills and insight to be reframed. We partner with child welfare experts to bring you evidence-based and research-driven information. reFramed host Emily Morehead, LPC, and guests strive to make an impact on our world by creating conversations about topics that are important to you, your family, and our communities.
Hi, welcome back to another episode of reFramed. Today I have 3 music therapists joining me today to share with us about the power of music therapy. This podcast is going to be a little bit different because we're going to take time to interview each one with different perspectives. Right now I'm joined by Sammy. Sammy, tell me about yourself.
My name is Samantha Graham. I am a board-certified music therapist. I graduated Sam Houston State University with my degree in music therapy and minor in psychology in 2017. I interned with Heart and Harmony Music Therapy, which is a private practice here in Fort Worth, and I've been working with them ever since. I've been working for about 2 years now.
So tell me about music therapy. I'm a therapist, so I feel comfortable in my lane of understanding therapy, but music therapy is a new concept to me. So walk with me through how you became a music therapist and what music therapy specifically does.
Okay, so my story about becoming a music therapist was in high school. I did choir all throughout school, and I was a senior, and people were asking me, where are you going to college? What are you going to do? And I really had no idea. I knew what my interests were. I knew that I loved music. I knew that I loved helping people. I was interested in psychology, but I didn't really want to commit to any of those routes. I didn't want to be a music teacher. I didn't want to perform for a living. I didn't want to become a psychiatrist. So I felt very lost, and I asked one of my choir directors what I should do. And her husband's a speech therapist in the school district, and she was like, well, have you ever heard of music therapy? And I was like, no, but that sounds perfect.
Sounds like everything that I'm saying to
That's
you.
everything that I want. So I Googled it when I went home, and I saw this viral video. It wasn't actually music therapy, but it was of a man with dementia, and they put on music from like in his early 20s. It was like Cab Calloway. So this man was very like turned into himself and very withdrawn and quiet and not speaking. They were trying to ask him questions, non-responsive really. And then they played music from his youth, and he started singing along, and then for like 30 minutes afterward they talked with him. So that was like my first picture of what like music could do. Yeah. And from there I was like, all right, I'm doing it. So I looked for programs. Sam Houston State was only an hour and a half for me. And that's how I'm here now, basically.
What does music do in the brain? So how did that happen for him, and why is music therapy important?
So the really amazing thing about music is that it's not designated for one specific part of the brain. You know, we have areas of the brain that are for motor movement, for memory, for processing math, for emotional expression, and music is accessed in every major part of the brain. So that has huge implications for music as a therapy. A lot of it has to do with the concept of neuroplasticity, which is new neural connections, and so that can be attributed to a lot of the phenomena that we see, just because it has such a far-reaching effect on the brain. So it affects, you know, our whole body.
So walk me through the neuroplasticity. We've talked about that on a few of our episodes. Yeah. And so basically what we know is that popular belief is that 0 to 3 is like your major time frame for a brain to be developed. But what new research is showing us is that the brain is always growing, and new experiences shape us each day. And through new experiences, those neurons kind of connect in our brain and create experiences. And so is music able, when you were talking about the music that he related to, was it able to take him back to those experiences?
In a way, yes. So what we know is with older adults particularly, that music from their young adult stage in life is typically what is accessed, and the further along they get, if they do have something like dementia, the further back the music goes. So like being able to recall things like, you know, You Are My Sunshine, or like Twinkle Twinkle Little Star, things that they remember later on.
When you're talking about how we experience music, what happens in our bodies? So if you were to turn on some Leon Bridges for me right now, what would activate in my brain? What would happen?
So you would get a big old hit of dopamine, because who doesn't when they hear Leon Bridges?
Sure.
And you are going to start to entrain to that rhythm, whether you recognize it or not. So our bodies are very musical, very rhythmic. Our breathing rate, our heart rate, our walking are all rhythmic, and then even our speech is very musical. So when music comes on, that's why we start tapping our toe. We don't realize it. If you're walking, you start walking to the beat. If you're standing, you might start grooving a little bit, because I'm thinking of Leon Bridges. And so that's what your body would start to do, and your brain would release dopamine. So that, and I'm sure Annie could speak a little bit more to this, but that is really how neuroplasticity works, is that there has to be no dopamine for that to take place, those new connections. And so for those older adults, he had positive experiences in his younger years with that music because of all the hits of dopamine. And so then he heard that music and was able to, get those memories back that were lost
So
or inaccessible.
would I regulate to you? So if you were a calm caregiver, for example, so let's say you're mom and I'm kiddo, and you turn on some music and you're regulated and calm, but you're telling me to calm down and that's not helping, the music then in turn could regulate our systems because I would be also experiencing those same calming factors. Is that true?
Let me make sure. So you're saying if caregiver is calm and the child's not, and you put on some calm music, would the child regulate to it? Possibly. Sometimes it requires us to meet them where they're at, which is another technique that music therapists use. Like, for example, music therapists sometimes who work either in preschool or like with kindergartners, if they come in from outside to music therapy, she can't just be like, all right, everyone sit down and we're going to start and be quiet. She's got to start with something with movement to like meet them where they're at, and then through the song it can gradually become more calm to get them to a seated place. So in that situation it might work depending on the child, but also it might be better to play something that maybe matches their intensity of that emotion, something upbeat, and then you can, get them to a more calm place.
That makes a lot of sense. So I've seen a lot of work about music therapy with individuals on the autism spectrum. And so what does that look like, and why is that a new cutting edge treatment?
Yeah, so music therapy has a really profound impact on those with autism for a few reasons. One of those is that music is organized in nature. It's also very engaging. So it can help with things that we would, consider maybe like sensory overload, right? So a lot of people who have sensory processing issues or sensory impairments, something that they can attach to that is very organized and structured is helpful. It's also a way to connect non-verbally. So a lot of people with autism are either, partially verbal, or they might be verbal and they just prefer not to communicate verbally. So music is a way to have a conversation and connect and socialize without necessarily having to use verbal speech, although you can, and it can actually, help enhance that if they do prefer to communicate verbally. And then I would say the third big thing is the sensory input. So on one hand, you have some people on the spectrum who have issues with being overloaded with sensory input, but then you have some who require a lot of sensory input. Might do things like stimming, and sometimes stimming can be things that are like self-harm type of behaviors if they're upset. And so having music as a healthy form of sensory input, whether that's actively playing music or just listening to it, I think that's another key element for why it's so helpful with those on the spectrum.
What about with social skills? I know that can be sometimes a struggle. Yes. Is there a way music therapy can kind of incorporate that in a non-confrontational or a more comfortable way?
Absolutely. There's a song that a lot of us in our practice use to help work on conversational reciprocation with individuals on the spectrum, or really anyone who wants to work on social skills. But because there is that kind of give and take in music, we can work on that a lot, just like musically encoded cues. So,
will you sing it to me?
Sure. Okay, so When somebody asks you a question, you answer it and ask it right back. So we'll sing that. It's kind of like a prime.
I feel like you were just Mr. Rogers, and it put me in such a good place.
I love being compared to Mr. Rogers. So you can sing that in the session, and then I could say, hey, how are you doing today? And you can answer me.
I'm doing good.
That's so good. I'm so glad to hear that. And then if you need the additional cue, I could either just kind of lightly strum my guitar again, or I could say, you answered the question, and then now ask it right back.
Yeah,
See me,
that's
how
what
are
my
you
brain
today?
just did. Yeah.
So, and then eventually, so with some of my clients now, we've been working on it, so now we don't need the musical cue. Yeah. I'm just like, so how are you? And then sometimes there still needs to be that little bit of that awkward pause, but then it's like, oh yeah. And that's a nice way to get to know friends, right? That's what we do. What do you like to do? What do you like to listen to? So it's just like a helpful cue. It's very Daniel Tiger, Mr. Rogers, you know, just little musical cues.
But it's funny because you explained that, you know, for children, but my brain did it because when you did the tune, I was like, oh, I was supposed to ask her how she was as well. Yeah. That's really cool.
Yeah. I'm trying to think if there's any other big things we do to work on social skills. There are some music therapists who work with groups with individuals with autism, and so you can work on connecting with others in different ways that's maybe not so intimidating. Instead of just sitting there and working on eye contact, you're going to look right at me. Just sharing an experience together with a group of people and just knowing like personal space and things like that.
So when we were talking about groups, you with social skills, and a recent training that you did at Gladden University, you shared a really great example of a group exercise. Kind of walk me through what that looked like.
Yeah, so that was like musical bop it, if you want to call it that. And I've done this in a few different types of groups. So essentially, everyone is assigned a different instrument with a different cue, like scrape it or hit it or shake it. And I have a metronome going. And it's just like bop it. I give out random different commands, and eventually the tempo increases. And so it is a great way in a group setting to work on things like selective attention, focus, impulse control, even maybe like frustration tolerance, because it can maybe be a little anxiety inducing. So it addresses a lot of different things, and it's pretty cool to see. It's engaging and fun as well.
Thanks for joining us, Sammy. We're going to have Annie join us and walk us through a few other points, but I really want to show an example of that clip that you just talked about, so check it out.
All right, y'all ready? So we'll do a little practice round. So I'm going to say it, and then on the next beat, you play your instrument. Okay? Shake it. Pull it. Hit it. Ring it. Scrape it. Y'all are great. All right, I'm gonna bump it up. Yeah, it sounds like a frog. Okay, y'all ready? Ring it. Shake it. Pull it. Hit it. Scrape it. Scrape it. Shake it. Ring it. Pull it. Hit it. Scrape it. Shake it. Nice. All right. We're going to bump it up. Ring it. Hit it. Shake it. Pull it. Hit it. Hit it. Hit it. Shake it. Scrape it. Ring it. Pull it. Ring it. Ring it. Scrape it. Hit it. Shake it. Pull it. Scrape it. All right, lightning round. Shake it. Ring it. Pull it. Hit it. Scrape it. Scrape it. Shake it. Hit it. Pull it. Ring it. Scrape it. Hit it. Ring it. Ring it. Pull it. Hit it. Shake it. Nice. Y'all are awesome.
Now I'm joined with Annie. Annie, tell me about yourself.
Thank you. My name is Annie Robertson, and I'm a board-certified music therapist. So I finished my undergraduate degree in music therapy at the University of Alabama in 2018. I did my clinical internship at Heart and Harmony here in Fort Worth, and I've stayed with them ever since.
Awesome. So Sammy shared a little bit that you kind of have some expertise with brain. So tell me about what happens when we take in music. What happens in our brain?
Yeah, so like Sammy mentioned, the really cool thing about music is it is processed everywhere in the brain. And so music affects all the different parts. It's a really key factor in neuroplasticity. So when you hear music, you're getting that dopamine release, which is really key for forming new neural connections. It strengthens existing bonds, and it is also responsible for remapping different parts of the brain. So like you'll see with folks who've experienced a traumatic brain injury or a stroke, maybe if you've had a stroke on the left side of your brain and you're unable to speak, through the power of neuroplasticity facilitated by music, you can actually learn to move all of those different processes in your brain involved in speech to the right hemisphere. Wow. So you can learn to adapt totally new skills in a different part of the brain.
So is that what the remapping means?
Yes, that is what the remapping means, to change where those things are located. Wow. And yes.
And so when someone's experiencing music therapy, what settings do people typically experience that through?
All kinds of settings. So music therapists work with babies in utero all the way up through hospice care. So sometimes that looks like music therapy in a hospital setting, looks like music therapy at home health and behavioral centers, in schools, residential centers, correctional facilities. Just really anywhere that there are people, there is music therapy.
Because it really does impact so many different people in so many different lifespans.
It does. It really does.
So I've seen, even an early lifespan, I've seen pictures of moms with like headphones on their bellies when they're pregnant. Walk me through like how in utero exposure to music happens and what that does with that fetus and that mom.
Yes, I'm glad you brought up headphones on the bellies. Sometimes we think that we have to extra project music at our baby, but our babies are always listening. Mm-hmm. They are hearing their parents' voices, they're hearing the world around them, albeit a little muffled, but that's a developmental level of volume for them that's appropriate. Sometimes when you use headphones or try to extra amplify, it can actually cause distress for the baby. Wow. Some of that kicking of, oh, they're just excited to hear Van Halen, like might actually be distress. But yeah, babies hear the voices around them and they can actually learn to recognize music in the womb. So babies that have their mothers sing to them, have their parents sing with them, can recognize those melodies after they're born. And babies, regardless if music is used, can learn to recognize their parents' voices, their parents' language, and their regional dialect, all in the womb. And music can really help to facilitate and strengthen that recognition and that bond.
When I even think about babies who are, with, placed for adoption, when we think about, they've heard their birth mom's voice, and so there is that longing for that familiar even sound sometimes.
Yes, absolutely.
And so we've seen parents do, birth parents do the Build-A-Bear, where they're able to speak into the heart, or I think Hallmark sells a book that they can read. Mm-hmm. And so there's been some really cool techniques that we've seen adoptive parents and birth parents do to help that child continue that connection.
I love that, yes. Mm-hmm. So impactful.
And do you see that? So, for example, I've seen a lot of news stories about babies who are in NICU. Yes. And so they're not getting that skin to skin immediately, or that, snuggle that we would hope, we would typically get at birth. Mm-hmm. So what does music look like for them? What happens in their brains when they're able to receive that?
So music therapy is super important for our NICU babies. Research shows us that babies who receive music therapy in the NICU gain weight faster, that they leave the hospital faster. And it helps them build their neurologic pathways. There's also a lot of potential for harm with NICU babies. So NICU babies can't tolerate more than 4 hours of music a day. Then their measurements, like their heart rates, blood oxidation rates, will actually decline. They can only tolerate so much. They can also only tolerate music that is within specific parameters. So only music that is so complex, that is so loud, so fast. We know that boy babies respond better to music that is just sung a cappella, and girl babies will respond better to music that has guitar accompaniment. And so that's why it's really important to have a board-certified music therapist who's trained in these processes and knows how to apply the specific aspects of music to do things like help babies stabilize their heart rates, their blood oxidation rates, to bond with their mothers. We do a combination of lullaby singing and neurologic massage, to help them build those neural pathways to learn where their bodies are in space. They're not always getting that hugging, that loving when they're in the isolette all day long. And also to get that contingent response. Babies who are in the NICU are typically fed and changed on a schedule. They may not always be able to leave the isolette, or their parents might not be able to be with them in the NICU all day long. And so when we do the music, we watch them very carefully, both their measurements on the monitors for heart rates and stuff like that, but we also watch their facial expressions to see grimaces, to see if they give us a stop. NICU babies will give stop hands. And they learn that when they communicate those things, there's a response that happens. We stop our music, we drop back the amount of musical cues and stimuli we're giving. So they learn that call and response even from that early time on.
Is there an age that works best? So is there, if you're 30 weeks, like this works for you, but maybe 26 is too young, how do you determine who's ready to receive music therapy?
So there is a pretty set protocol in place based on the baby's gestational age and what they're doing day to day. We'll usually check with the nurses first before we go in, and then just monitor the baby to see. We start, with just very low humming with a simple melody. We'll open that up to oohs, which is more complex, and then we'll add words in, add a guitar accompaniment if that's appropriate. We slowly layer on all these more complex stimuli. And some days the same baby from day to day is not going to be able to process as much stimuli. It's really all tailored to each individual baby.
How does it work with pain? We've talked on our show about babies who are withdrawing from drug usage, that there's, a high level of pain for them, and so there's medication intervention needed. Is there, even for some of the pain of the surgeries that maybe they've had, does music help does music impact that pain level? Does it decrease it? How do you measure that?
Absolutely, yes. So across the board, not only from NICU babies, but throughout the lifespan, music is an audio analgesic, so it's a pain reliever. We know from the gate control theory of pain that the brain can only process so much stimulus at one time. So pain is really overwhelming, but if you can have another outside stimulus to focus on, to lock into, that pain response will decrease. So you can use music to relieve pain without having to administer any kind of medication.
Wow. How does that work with labor? I'm thinking, because when you're talking about the pain response, does that impact women who are in labor?
Absolutely, it does, yes. There is an evidence-based, research-based protocol as well for using music with women in labor that has to do with using music that's matched to the different stages of labor. So your heart rate will also match to the music that you're listening to. Your breathing will naturally match the music that you're listening to. So women in labor can use music that matches with the way that their body needs to perform during labor. Music increases a dopamine response in your brain, which will help facilitate the release of oxytocin, which is the natural chemical that sends your body through labor. It also provides a little bit of a natural pain release on its own, even without the audio analgesic factor of music as well.
Wow. I think about, there's so many women that I've heard stories of that are birth moms, and during their labor, they didn't have a support person with them. And I even think about how that music might even feel supportive or, come alongside them through the different processes of labor if they don't have someone.
Yes, absolutely. Music can be a huge emotional support with or without having an additional support person in the room, but especially for people who may not have many other levels of support. To have that space held, the music can block the environmental sounds and stress of the hospital, can make it easier to focus on yourself. It, if you're using things like your breathing or your movements as coping skills during labor, can offer that physical support as well as that emotional support to really validate, labor's a tough time, to validate those experiences, but the music moves out of the tension, it moves to resolution and gives you that hope that yes, you're moving too and you're gonna be okay.
What about like a connection ritual through labor? Is there, I know that there was a song that I listened to during a really stressful pregnancy, and it was kind of my ritual with my baby. Do you have any like tools for people to come up with a ritual like that, or kind of a connection principle for them?
Absolutely. So in music therapy assisted childbirth, we use what's called a womb song. And so it's a song that we sit down and write with the parents. That has kind of their affirmations for the baby, their love messages for them, and they practice singing that song to the baby in utero throughout pregnancy. And then once the babies are born, they will recognize that melody and recognize their parents' voices, and that can assist in soothing and bonding after they're born. And even with babies that if you maybe weren't able to through adoption to sing a womb song with them, you can still make that a regular part of your family's life of, all right, this is our lullaby song that we're going to sing together every night, or this is, however you're making music with your family to bond can be a very influential method of family bonding.
Thank you so much for joining us today, Annie. I want you guys to check out a clip that we used during a Gladney University training of Annie's example of the WIM song. When we come back, we'll be joined with Miranda.
I love you so, little darling. I love you so. With all my heart, little darling, I love you so. I want you here, little darling. I want you here, safe in my arms, little darling, safe in my arms.
I'm joined back with Miranda. Miranda, tell me about yourself.
So my name is Miranda Rex, and I'm a board-certified music therapist. I actually originally got my bachelor's degree in music education, but that was sort of not really where my heart was, and so I decided to get a master's equivalency in music therapy, and I completed that degree last August. So I've been practicing for about almost 2 years now, and I've been with Heart and Harmony ever since.
That's awesome. So I am so interested in the process of becoming a music therapist. First off, do you even have to know how to play an instrument? Can you have a terrible voice? How do you know that this is the right field for you?
So to become a music therapist, it's kind of like any degree. Most people enter in kind of being like, this is what I'm interested in, but you're not an expert. And so if you have like a love of music and any modicum of musical ability, you can go into school and learn these things. So you just have to have a willingness to learn. And sometimes what gets a lot of people out is music theory and music history, some of the more difficult aspects of getting that degree. But it's always worth a shot. And if you have a background that's not in music, but maybe a therapy background and you have a little bit of a musical background as well, you can also pursue a master's equivalency degree, which is what I did. And you just kind of have to make up the deficiencies that you didn't get in like a therapy program. So you would have to take some of those beginning music classes, but you wouldn't have to maybe do quite as much. We have a lot of primary instruments, but you can perhaps choose like a vocal primary, and you can take voice lessons and become a singer, and that can kind of be your primary instrument.
So there's definitely opportunity, and it sounds like there's a lot of good coaching.
Mm-hmm, yeah, but it is a separate degree if it's something you're going to pursue either as an undergraduate or if you want to pursue it, postgraduate work. It's a whole other thing. It's not like something you can just get a certification in. It's an entire graduate program.
Is there a licensure program?
There's not currently any licensure in the state of Texas, but there are a couple of other states where they do have a state licensure, but that's something we're really advocating for right now. In our state and local government is to get state licensure for a variety of reasons. But we do have our national Mtbc credential.
Because I was thinking if if a family was trying to find a music therapist, how they would know, is this a real music therapist or is this someone that just loves music? Right. What could they look for?
So definitely the Mtbc credential is something that people are required to have. We have to take an examination once we complete all of our coursework plus a 6-month internship. We have to take an examination and we have to pass it. And so once we do pass that examination, we are awarded the Mtbc credential. And so you may see other things where people are volunteer musicians or maybe music educators that are offering maybe adapted lessons, or I've also heard of therapeutic musicians, but they might also have an Mtbc credential, but if their only credential is those things without an Mtbc credential, then they're not a board certified music therapist, and so they're not technically doing music therapy.
Because my assumption is harm could be done in some of these situations if it's not handled correctly.
Yeah, most definitely. It's sometimes comes as a shock to people that music can be harmful. Even, in a room full of music therapists, if you say like music can hurt people, they'll think, what? But it just kind of depends. You can just listen to music and ever heard a song that made you angry? So that's something that can happen, especially with kids with trauma. Some music that has, male and female vocal voices can be really triggering for them, depending on the kind of trauma they've experienced. Or, some songs may take them back to a time where trauma was occurring. And so, it can be really dangerous sometimes if you're not really sure how to navigate those situations. And so that's why it's good to have a music therapist there, because we not only are we sort of aware of how to navigate that, but we also kind of know what to look for. And then, if we see a particular diagnosis, we know what kinds of things maybe to look out for when we're selecting music with these patients.
Can you tell me about working with children who are in foster care or who are adopted? How do you use music therapy to help their resiliency and their brain development and kind of mitigate some of that trauma?
Yeah, what's really great about music is that it is like so universal. And so you can form connections with people. It's like a great instant rapport establisher. You like music, I like music, we already have a connection. And music is something that's especially important for kids that are in foster care or transitioning into adoption, because music is something that they have had with them the entire time. It's one of the only things they've probably had that really belongs with them and has stayed with them through all of these other times of change. They have music that has always been like a stabilizing presence, so it's really important for them, especially in terms of forming healthy attachments. And just having something that belongs to them. Because, a lot of times when they're making all these transitions, there's not a lot of things they get to take with them, physically or, metaphorically. So music is something that they always get to have, and especially in this day and age where music is so accessible and portable.
I had parents ask, so they were adopting some siblings, and they had been exposed to some music that just had a lot of cuss words, a lot of derogatory language in it, and just kind of talking about different derogatory experiences. And so one of the things that they said was not in our house. But what I'm hearing you say, but that's what they owned. How could a family create boundaries with music, but also let the child take ownership?
So yeah, that's a really great way to sort of get involved and have sort of those conversations about, and it's also kind of when they're ready to have those conversations, what is it about this music that you relate to? And when I've worked with kids that have been in foster care or kids that have just been in behavioral health settings, it seems like you have some really strong feelings and you're expressing those through this music. What is it that you're experiencing that you relate so much to, this explicit language and these aggressive themes? And a lot of times the answer is either, well, it's not really about the words, it's about the music. Or the answer is, I just am never able to express myself, and I just have to use these strong things so that I feel heard, and because I have just had no outlets to express myself, so this is what I'm using. And so that's where it gets a little bit tricky sometimes, is because, it's navigating the boundary between music that makes us uncomfortable and music that can be harmful. And so that's why it's great to have that conversation and even maybe start to find a way to compromise if it truly is, expressing some really harmful themes or talking about some things that are really derogatory that you don't want, your kid to, subliminally take in and internalize as something that's a normal or rational behavior. So you maybe compromise first, you maybe get a clean version of a song and see if maybe the swearing is what's the issue. Or you get a song that maybe has a similar music background, but the words are a little bit different. Just kind of trying to figure out what it is that's working for the kiddo, and then maybe creating a playlist that sort of goes from maybe, the hard stuff down to something that's a little bit more useful for them and effective. And I would really encourage people to not label it as inappropriate music, maybe music that is harmful, or is, if you were expressing that, in normal terms, that would be hurtful to people if that's what you were saying in a conversation. Those are not things that you would say to other people. And so also bringing it back to what the music is saying and not what the kid is experiencing through the music.
Yeah, it almost places a judgment.
Right, and so it's if you're saying, your music is inappropriate, they internalize the message, I'm not appropriate. And so, or this music is bad, so I'm bad. And then, they're going to be more closed off and unwilling to share these things. And so it's really important to just kind of have that conversation or figure out a way to compromise, to figure out what is it that they need from that music? What are they getting from it? So that they aren't internalizing negative messages, but they're still able to hang on to something that has always belonged to them.
I wonder, I hear from parents all the time, their biggest parenting struggle is transitions sometimes. Can you walk me through how we could use music in transitions to help children, teenagers, us as adults?
Well, I mean, yeah, anybody transitioning is not easy. Even waking up in the morning and getting out of bed is sometimes hard. So just putting on music or figuring out what kind of songs will work, having the cleanup song, right? We've all heard that clean up, everybody, everywhere. Just that kind of stuff for everyday stuff, you know, cleaning up, doing homework, getting in the car, you know, we're gonna put on the Moana soundtrack, and by the time your welcome is finished, we're gonna be walking out the door, those kinds of things. And even for things like memorizing a phone number, you can use little jingles to create together, parody other songs.
And it almost, when you add music to those transitions, it seems friendlier and kinder. And what we know about behavior is that it's best received through play, is that if a parent can play with the child, it disarms that. And so I can just see music pairing so nicely.
Yeah, well, and music just doesn't feel like a chore.
Yeah.
You know, for a lot of people, it just is something that they enjoy. And so when you pair it with, you know, something that is a little bit more taxing or seems less fun, it's a better motivator.
Yeah. How can parents decide if music therapy might be the right treatment for their child? So maybe they've implemented these transitions. No, you're fine. Maybe they've implemented these transitions. Maybe they've, you know, provided care in these ways, and they're still struggling. Mm-hmm. How would they decide when to call you guys?
So what's really great about Heart and Harmony specifically is that Nikki, our CEO, founder, boss, fearless leader, she offers 30-minute phone consultations. So you can ask some questions about, you know, us, our practice, and maybe see, you know, if we think maybe music therapy would be beneficial for you. Excuse me. And then we also, and then everyone does this, we do assessments. And so we go in and we see like what the needs are of the child or even the adult. And then we go through and use different musical exercises to figure out, you know, how we're going to evaluate those needs, right? So whether it's, you know, communication, social skills, motor skills, things like that, and how we're going to use things musically to do that. And so in my personal experience, I have never had anyone that was deemed not a good candidate for music therapy. Most people, it's going to work for them. Or at least, you know, we'll figure out a way for it to work. But there are some people out there that it isn't really going to be super great for. So we know a lot of people with some sensory processing disorders might have an issue. And sometimes music therapy is great to use for them because it kind of helps with that. But sometimes if they're very sensitive, they might have a lot of sensory overload. And so it either, you know, needs to be postponed until we figure out, you know, some ways for them to handle more stimuli. Or, you know, if it's something that they think they can handle, we can transition from, you know, things that are less complex into things that are more complex. So it just depends. But that's why assessment is so important. There's also a really rare condition that is called amusia. And basically it's like you can't tolerate music. I think I read somewhere that only 4% of the population has a diagnosis of this. And there's a book by Oliver Sacks called Musicophilia, and he really goes into detail about, he's a neurologist that worked at Beth Israel, and he talks about patients that he saw that for whatever reason, most of them had acquired amusia. So they had some kind of traumatic brain injury, stroke, but it can also be congenital at birth. But essentially what happens is there's, you know, some different subtypes, but it's really interesting. They say that when they hear music, it just sounds like pots and pans banging together, or just like someone even said like a horse-drawn carriage on a cobblestone street. You know, it just sounds like noise to them. And that's really rare, and I've never run across it, but that's definitely something that can happen. And that may be something that even if you're not, you know, diagnosed with something formally, that music just may sound like noise to you. And again, that's why the assessment process is so important, because then we can figure those things out. And it may even just be specific instruments, you know, so it's really important to feel those things out.
So for families who want to practice in home with music as a tool to kind of disarm and bond and attach, do they have to be musicians?
No, and you don't have to be a musician to engage in music therapy, but if you want to engage in music outside of using a music therapist, a lot of the research shows, especially for kids that are in foster care, but even kids that are in non-foster homes, that formal and informal involvement in music is really helpful for their development and self-esteem, confidence, and informing attachments. And so involving them in things like private lessons or school ensemble, or even just going to any kind of musical experience together, a concert, a symphony, watching something on YouTube together of an old Metallica concert, things like that is really beneficial for family bonding.
You shared a really great example in a recent Gladney University training about just some really low-cost instruments that families could have in home that aren't your traditional like guitar or ukulele, and that really could promote family bonding through play. And so I want us to check out a clip about that. Thank you so much for joining us, Miranda.
Boom whackers. I've also seen them called boom boom sticks, but you can get them on Amazon. Kids love them of all ages. They come in a ton of different sizes.
Yes,
Exactly. You could make your own. Exactly. Yes, you can make your own.
Yeah.
Right.
There is actually tutorials on YouTube and stuff for making like flutes or like marimbas, percussion
Drums.
instruments, drums out of Home Depot supplies. Yeah.
All right. We got ocean drums.
It's a great sensory thing.
Yeah, and it's a great sensory thing for kiddos. It's good for relaxation. All right, we saw this earlier. We got cabasas. It's also really good.
Tactile stimulation, fidgeting. That is, some people really don't like that sound, so you gotta be careful.
Yeah. We got rain sticks. It's a rain stick. Very relaxing, also just kind of with the sound and just the repetitive movements. And we just got little things like little xylophones. I love to use this with my kiddos. You don't have to know a lot about music to be able to do that. And one of my favorites, one of my new favorites, this is called a Kalimba. All right? You just play it. It's also called a thumb piano.
Wasn't that a great clip about how families can engage at home? Miranda, thank you so much. Can you share with our viewers how they can stay connected?
Yes, so we have a website to connect with our practice, heartandharmony.com, and it has a bunch of information about our therapists, the different services we offer, and we also have a really great blog that provides a lot of information about the work that we do as music therapists and sort of like unique things that we may not get to talk about always with the community. And you can also email our boss. Her name is Nikki, Nikki, at heartandharmony.com. There's also a little thing at the bottom of the website where you can fill out, an information request.
Perfect. And you guys run a great Facebook too, sharing recent research that's been published and fun ways to connect. So I would really suggest you guys check that out. And we'll link your information in our show notes. Thank you so much for joining us today. We're going to end in a really fun, special way.
Goodbye to Gladney, it's time to go. Goodbye to Gladney, it's time to go. I hate to leave you, no, I really must say goodbye, my friend, goodbye. Goodbye, my friend, goodbye.
Thanks for listening to reFramed. Visit gladneyuniversity.org to access the show notes and learn about upcoming trainings at Gladney University. We'd love your feedback, so please rate, review, and subscribe. Until next time.